Good morning, Wendy.
Morning. Can you hear me?
I can.
Okay.
Morning, Victoria.
Yeah,
Andrea.
what up to
The computer on mute.
your collar's jacked up?
So quiet. Wendy, you don't have music you can play? Christmas music? Holiday music?
Good morning.
Good morning.
Trying out my sound to make sure it works this time.
We can hear you.
Thank you. Ryan or Veronica, do we know if anyone on the board will not be able to attend?
Victoria said that everyone said that they would be here.
Okay, thank you.
Yep.
Good morning.
Well,
Morning.
good morning, Dr. Cleary.
How are you, Gail?
I'm doing well. How about you?
Oh, not too bad.
It's a
Enjoying a
gorgeous
sunny
day.
morning.
It is. I see a little sun in my window and yours too. So it's good.
Yeah.
Good morning, Commissioner.
Good morning, Gail.
Welcome.
Well, thank you very much. It's good to be here. And Dr. Cleary, good morning as well.
Good morning to you.
I'll say good morning as well.
Good morning.
Well, good morning, Commissioner.
Good morning, Gail.
So once we get the meeting started, we'll go around the room so all the board members can identify themselves. We're delighted to have you, so welcome.
Thank you.
I can't even imagine you new commissioners with your schedule. Must be pretty interesting right now.
Interesting as a
Mine started a little sooner than I admit that I thought. So I'm juggling some other things too.
Gail?
Yes.
Since we have new members, and I kind of include myself in that, is there a copy of bylaws or a charter for the Board of Health beyond just the RCW? Is there anything
So-
that addresses our rules of order and individual duties?
So Ryan, I'm looking at you.
Yeah, so there's there are some bylaws that discuss the makeup of the board, but there's no, as far as the duties and the how the meetings are ran, we don't have anything on that.
Okay.
And I can discuss a little intro to that if you'd like at the beginning of the meeting for our new board members.
So that may be something that we just need to take a look at and be more specific with. Another thing on the to-do list for 2021.
Yeah, usually we have an orientation for new board members.
Yes, the pandemic has definitely changed our direction.
So I can't necessarily see everyone on the call, but I don't know that we have a quorum on the call yet. Is that correct?
We have 5 of the 7 that I can see.
Oh, okay. Perfect. That just is
Barbara's
me.
on the line. It might be a little hard to hear her.
Okay, I think that was Barbara Harris on the line. Is that correct?
Yes.
Okay. All right, thank you. So I will go ahead and call the Board of Health meeting to order. Welcome to everyone who is on the call. Wish we could meet in person, but I'm glad to see your faces. We have some new members on our board, and so we will start with introductions of guests and staff. And then we'll go into, I'll ask each board member to identify themselves. So Ryan, do you want to do the roll call first, and then we'll go into introductions?
Okay, sure. So Gail Weaver, citizen member, board chair.
Here?
Barbara Hare, mayor of Hera, city representative. She's on the line. So, Commissioner Ron Anderson.
Here.
Dr. Sean Cleary, citizen member.
Here.
LaDawn Lindy, commissioner.
Yes, here.
Amanda McKinney, commissioner.
Here.
Dr. Kay Funk, city representative, Yakima City Council.
Here.
All right, Yakima Health District staff, Andre Fresco, executive director.
Good morning.
Myself, Ryan Ibach, chief operating officer. Chase Porter, senior finance manager.
Present.
Melissa Sixberry, director of disease control.
Here.
Lillian Bravo, director of public health partnerships.
Good morning, here.
John McGee, director of environmental health.
I'm here. Good morning.
Nathan Johnson, local emergency response coordinator.
Good morning.
Dr. Larry Yucca, health officer. He's on mute.
Oh. Here. Am I off mute now?
Yep, you're good. Wendy Garcia, public health technician.
Here.
Victoria Reyes, administrative assistant.
Here.
James Elliott, attorney.
Good morning.
Good morning. And then if we have any guests or press, if you can type your name and any affiliation in the chat box, so we can put that as part of the minutes. Anyone else that I missed? Okay.
Okay, thank you, Ryan. So welcome to all of the new people on the board. And so what I'm going to ask is that we go around and at least say our name and our position on the board. I'll start with myself, and then let's go to Dr. Cleary, Dr. Funk, Barbara Herrera, and then to our 3 county commissioners. Again, I'm Gail Weaver. I'm chair of the Board of Health, and I'm a citizen member. I'm retired from a career in healthcare. So let's go to Dr. Cleary.
I'm Sean Cleary. I'm a citizen member of the board. I'm a retired physician, having been in clinical practice for 25 years in Yakima, and I'm a physician volunteer for the Yakima County Sheriff's Office for search and rescue and mountain rescue.
Dr. Funk?
Yes, I'm Kay Funk. I'm also a retired physician, and I'm elected member from the Yakima City Council. In practice, I was a family medicine doctor.
Thank you. Barbara Herrera? Okay, we'll come back to Barbara. Commissioner Anderson.
Good morning. I'm Ron Anderson, Yakima County Commissioner, District 2, just completing my first term and looking forward to my second term as commissioner.
Okay. Commissioner McKinney.
Good morning, Commissioner McKinney representing Position 1, District 1. Just beginning, I guess, 4 years and 1.5 months.
Commissioner Lindy.
Yes, good morning. This is LaDon Lindy. I'm District 3 County Commissioner. Transitioning out of my last job, which is a corporate compliance officer and medical staff services director at Astoria Sunnyside Hospital.
Okay, thank you. Dr. Yucca.
Yes. Well, I'm Larry Yucca. I've been in public health for numerous years. I had 23 years in the Air Force and well over 30 years and health officer in public health over 9 different counties throughout my career, 8 of them in Washington State. So been around a long time. I'm glad to be here. Thanks.
Welcome, Dr. Yucca.
And a nice familiar face. Gail and I go way back. I think 1997.
We worked together in 1997, so it's good to see your face again. So welcome to everybody. Our administrative team will actually introduce themselves as they give their reports. So let's start with the agenda. We have a review of submitted public written comments, first of all. So Ryan Ibach, our Chief Operating Officer.
All right, we have received some written comments regarding reopening of schools. So I'll read the name, the subject line, and the sentence or two from each of the written comments. And so the first one is from Bailiana Simpson. And she says, I am a senior at Sela High School, and I thought I would reach out to you to inform you of just how much keeping us out of school is detrimental. First, I would like to point out the effects of our mental health. For a lot of us, being in a social environment is truly beneficial. Secondly, being in the classroom is important. A lot of us find it difficult to focus if we learn on the computer, which is also affecting attendance. No more online school. The effects can sometimes be irreversible. That's Bailiana Simpson. The next email we have is from a concerned parent. And she writes, I have concerns about how the school closure has affected my children. A primary concern is my children's mental health, not being able to socialize with other kids. What long-term studies does the state have on the long-term effects of children's mental health when they are kept out of school for 8 months to a year? At what point is the state responsible for the impact of our children? Children are experiencing mental health issues. Children are not learning anything. Children are being exposed to someone taking advantage of them online, and parents are being forced to be teachers on top of their job. The next one is from Bethany Hartman. And she writes, I would like to add myself to the list of parents who are advocating for high school students to be allowed back in the classroom for learning. My daughter Avery is a sophomore this year, and although she is a strong academic student, the impact of being out of school is impacting her social well-being substantially. The next one is from Jennifer Bear. She says, I am a parent of 2 boys at Sela High School, a senior and a sophomore. I am writing to strongly request the pause be lifted on our high school so we can start hybrid learning as scheduled on December 7th. The home learning has been a major hardship for my sons to receive any quality instruction. Focus is very difficult, as is the isolation they have had with this method. Please reconsider this pause. Then we've also received a written comment against the reopening of schools. And so I'll read the name, the subject line, and a couple of sentences from this email. So this email was from Robert Hayes. And he writes, my name is Robert Hayes, and I am the behavior specialist for the Sunnyside School District. I'm writing to you today to express my opinion and philosophy about the Yakima Health District's recommendation to open schools in a hybrid model. The Yakima Health District mission reads to promote, protect, and enhance the health and safety of all. I fear that the decision to move to a hybrid model was influenced by others. In turn, I do not believe that this recommendation promotes, protects, and enhances the health and safety of all. The metrics used for this determination are failing, with the exception of one. This is the metric that states less than 80% of the beds are being used by patients. The idea that we are clinging onto here is that since there are more available beds for sick patients, it is okay to let more people become sick. This, I feel, is unacceptable logic. By continuing to have schools open, we are contributing to the problem and not being part of the solution. The only question I would present to the board is, how does opening up the schools in a hybrid model actually promote, protect, and enhance the health and safety of all? So most of these questions I will, in my report on schools, I'll address many of the questions.
Okay, thank you, Ryan. Okay, let's go on to the consent agenda. We have 2 items on the consent agenda, the October 28th, 2020 Board of Health minutes and the payment of accounts payable and payroll of $491,433.54. And I would entertain a motion to approve the consent agenda.
This is Ron. I still move.
Is there a second?
This is Sean. I'll second.
Thank you very much. Any discussion? All those in favor say aye.
Aye.
Aye. All those
Aye.
opposed?
Aye.
Okay, Dr. Funk, let me just make sure, was your aye in favor or opposed?
In favor.
Thank you. There's always a little bit of a lag, so if I ask that question, it's just because of the timing. So thank you, Dr. Funk. So let's go on to board business. Andre Fresco, Administrator.
Thank you, Gail. Good morning to our board and to our guests. Grateful to be here with you. I wanted to begin by acknowledging the service of 2 of our committed partners. I think that this has been a difficult time for our community, and these people served admirably. So I'd like to acknowledge that former Commissioner Vicki Baker served during the coronavirus pandemic. And so we are presenting her with a plaque. It just reads, in recognition of health leadership and public service to the citizens of the Yakima Valley during her tenure. And we wish her well, and we'll send the plaque to her. Additionally, I'd like to acknowledge our former health officer, Dr. Teresa Everson, again with a plaque that's similar in sentiment. But Dr. Everson served admirably in a circumstance that none of us in public health could have predicted. This has been an incredibly difficult response, and she worked exceedingly hard on behalf of our community, and we're grateful for her service. So we'll send that to her as well. And that gives me the opportunity to, one, personally welcome our new commissioners, Commissioner McKinney and Commissioner Lindy to the board. This isn't, as Ryan mentioned, our normal process. This certainly was something that we addressed with Dr. Cleary when he came onto the board, which was the exceedingly hard deadlines and the reality that we are really working, all of us collectively, on behalf of the community. So I welcome you personally, and we are grateful to have you on our board.
Thank you very much, Andre.
I wanted to begin by recognizing our new health officer, Dr. Larry Yucca, and explaining how he was chosen to be our interim health officer. The role of a health officer is pivotal to our work in public health, and by law, we have to have a health officer. So we are grateful that Dr. Yucca decided to join us. Dr. Yucca mentioned his previous experience, but I think he's being humble. He has been a presence in Eastern Washington as a health officer for many years. He served admirably with the Benton Franklin Health District, and he currently serves as the health officer for Walla Walla and other counties. But that doesn't fully describe his presence and his value to us in public health. He has been committed to rural health care and specifically public service, not only in his military career, but also in serving people from all walks of life. He's extremely well respected around the state. He's helped build the systems that we rely on now that many of us who are new to the state take for granted. He helped create. And he's also very, very keen to the needs of an agricultural community. So we feel very privileged that he's joined us. And he has already helped us in numerous ways in our work to date. So if you don't mind, I'd just like to explain that we worked under the direction of our board chair, Gail Weaver, and our vice chair, Commissioner Ron Anderson, to create a contract with Dr. Yucca. And so this was done in coordination with the board to make an immediate hire that was necessary for us by state law. What I'm going to ask of you now, though, is a recognition that as our new health officer, our interim health officer, that we seek board approval to create a contract with Dr. Yucca. And happy to explain that process, but that's something that I feel meets state standards by having the board approve his position as health officer with us.
Okay, thank you, Andre. So I would entertain a motion from the board to appoint Dr. Yucca as interim health officer for the health district.
This is Ron, so moved.
Thank you, Ron. Is there a second?
Second, this is Kay.
Thank you, Dr. Funk. Any discussion?
Just quickly, can you give us a little bit of detail about the terms of the contract?
Well, we're right in the midst of that, sir. What we're planning to do, because Dr. Yucca is serving as another health officer, what we think we'll do is do a monthly stipend, if you will, for his services. This work is exceedingly difficult and ranges by hours. So Dr. Yucca has been kind to say that a monthly amount would be helpful. We're in that negotiation process currently, and we'll have that finalized. I will say that with an hourly rate, the amounts become excessive. And so Dr. Yucca, again, has been very humble in his approach, which is that he serves as our health officer regardless of hours. So we're grateful for that. We will be working with Board Chair Gail Weaver on this, and also with our attorney, James Elliott, who's on the phone now. And that also is important for me to share that Dr. Yucca has chosen this in an interim basis, and so we will be working with you as board members in the coming months to design a permanent position at the health district. I know that there's interest in having somebody local, but we also have to acknowledge the fact that it's a very specific skill set and experience level, so that's what we'll be working on as a team.
I do have a question that pertains with Lardon. I'm not comfortable approving something if we haven't read it, and if the agreement is not there to be read, I'm not certain how a board can approve something without knowing exactly how much it's going to cost and what the terms and the limitations are. So is it best to table and wait until we see the agreement?
I agree. If there isn't an agreement to approve, I'm not sure what the motion is for.
Well, what we wanted to do is acknowledge his working with us, and we can certainly get the contract to you for your review.
Certainly.
At the same point as Dr. Cleary, what I was saying, I'm not comfortable voting on something and approving someone if we don't have a contract that we can review to approve.
Yeah, we were happy to have him here, but yeah, it's nice to see some details.
Okay. So would Gail, in a process of getting a contract to the board through an approved email process, would you be comfortable with that?
I didn't hear all of that, but could you say that again?
Oh, yes. So if we have the approved contract, or rather the proposed contract, if we could work with you and Vice Chair Ron Anderson on finalizing that and then having it sent to board members for their review and approval, would that be comfortable for you?
Sure.
Okay.
Yes.
So that's what
Other comments that people have so that we're clear on the board expectations moving forward?
This is Kay Funk.
Yes.
Well, I think that we need some sort of board approval because we have to have a health officer, right now. Maybe our motion should be modified to saying that we have the expectation of writing a contract. And I appreciate Andre's remarks on the difficulty of going with the hourly rate. That's certainly, COVID was a real game changer in the work environment for all of the health district staff and Dr. Everson in particular. But now we have more experience. Our new health officer has more experience working under those conditions. His work is going to be modeled on the work that he does in Walla Walla. And so we have more understanding of how to write that contract. And I agree that a monthly salary is appropriate. And what I'm saying is that I think we need a two-step process to approve his coming on board and then to finalize the conditions of the contract.
Okay, thank you, Dr. Funk.
Gail, this is Ron. If it's proper, I will withdraw my motion and modify it to say that to enter into contract negotiations with Dr.
Okay, thank you, Commissioner. Is there a second?
This is Sean Cleary. I'll second that.
Okay, any discussion on the revised motion? Okay, all those in favor say aye.
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 All those opposed? Okay, thank you. Okay, back to you, Andre.
Yes, thank you. And what we've seen is the process of the board in action, which is that essentially our board is both a policy board and a finance board in terms of review of our process financially and also our normal operating model. So thank you so much. This is helpful to us. And again, I want to thank Dr. Yucca for joining us and also your patience as we navigate essentially an emergency that's ongoing. So thank you so much for your support. I wanted to pivot to something and really keep it very high level, which is the COVID-19 update. You will hear a great deal from our colleagues' reports today about COVID-19 and what we're dealing with, but certainly we are dealing with a tremendous number of difficulties right now. And I hope that you can hear me. I'm being told that it's difficult to hear me. Is everyone?
It is. You might get a little bit closer to your computer.
I feel like my forehead's getting bigger. How about this? Is this better?
Yes.
Oh, thank you so much. So essentially, we are in the middle of an outbreak status with COVID-19. I know that a month ago, there were discussions about the fact that numbers were rising in places like Seattle and Spokane. We predicted that we would be in similar circumstances, and we have now been in that situation for a number of weeks. The situation is severe. We have many, many numbers of positive cases each day. We have hospitalizations, and we certainly had, unfortunately, losses of life. So this is a very serious situation that we are now embracing in Eastern Washington, as was evidenced in other parts of the state. Again, our colleagues will go into more detail, and I will certainly be happy to answer any questions you have. But we are in essentially a second wave. I know that the United States and other parts of our state are in third wave. We view this as a second wave for us because our first process of an outbreak in the spring and summer was so long. We considered that one long wave. Regardless of whether it's 2 waves or 3 waves, it's a very difficult situation for all of us. We recognize the impact, both emotionally, financially, and in terms of people's health. We recognize that this is a difficult time for people, and we also recognize that it's happening during the holidays. We are moving into a dangerous situation, not only because of the trajectory of the virus, but also because we have cold weather, and people have moved indoors for both, for many parts of business and for recreation and socialization. So we recognize this to be a very difficult time. We would like to, again, share very candidly that this is a dangerous time for Yakima County, and our goal at the health district is to continue to provide opportunity to keep as many people safe. And we've made advances in that you'll hear again from our colleagues. So we are committed and dedicated to getting through this process, but it is long and it is difficult, and we want to recognize the hardship of our county. So I would like to keep it brief because there's so many things that have to be discussed, but if the board has any specific questions, I'm happy to answer them.
Okay, thank you, Andre. Let's go on to the financial report. Chase Porter, our Chief Financial Officer. So Chase.
Morning, everyone. My name is Chase Porter. I'm the finance manager here. I've been here for 4 years. In a month, I'll be here 4 years, and I've been in the accounting field for over 15 years now, which is kind of odd to say. So that's kind of a long time. I really don't think about it until you put it down on paper. So I'm going to start review the financials. I'm going to go fairly quickly. I'm sorry for the people that are fairly new to this call. If you don't know, I have a tendency to get a little bit deep into the weeds. So I am going to try to stay away from that. Because we have a lot of stuff to talk about today. But if you have any specific questions, please ask. And if you would like to meet anytime other than now, that would be great. Would you please move down to page 9. There we are. This is our financial summary for October 2020. We have an excess of revenue of 100,000, bringing our total excess to 850,000. Our total budget for the year is 6.4 million in revenue, what we set for last year, and 6.8 in expenditures. Right now, our allocated budget through October should be about 5.4 million, and our expenditures at 5.7. That's what we budgeted. Our actuals are over in revenue, 5.7 for the revenue, and for expenditures, just under $5 million through October. Will you please move? Any questions about this page? Moving into the next page. So I just want to specifically point out the revenue over on the monthly side. It'll look a little bit clearer when we move into the COVID income statement, but funding for COVID keeps on changing. And so historically, most of our revenue comes from Department of Health, and Department of Health doesn't work with FEMA very often. We're getting a lot of funding from FEMA. And so there's been a lot of kind of back and forth and changes. Up until September, we could charge an indirect rate, but then in September, FEMA said no more indirect rate. So that was a change. Health districts have always historically charged an indirect rate, while FEMA has historically not ever accepted it. So there's been some juggling as that goes. That's all I really wanted to point out for this piece. We're spending a lot of money in advertising and promotion. And a lot of our other programs are operating as normal as can be, so to say. Any questions on the first page of the income statement? Will you please move to the next page? Again, there's nothing specific on this page that I'm going to point out, unless there's any questions.
Chase, just a second. I just back on the income. Real quick, you'd mentioned the COVID funding. I'm wondering if you could kind of explain, give an overview of how much that is and what that looks like, what form that takes.
Sure. So we have several different buckets, if you will, of COVID funding. That's how internally that we've been discussing them is our COVID buckets that we review. So part of that, a lot of that is about $5 million is coming from FEMA, which is a federal grant, while we have several smaller state grants. The state grants are been a little bit more flexible, and they go into next year. So and then our current federal FEMA grant expires at the end of December. So we're really trying to maximize that grant right now to free up state money for next year. Our policy has always been here at the federal at the health district is to spend federal money first. So try to maximize our federal grants first. Second, state, any state grants or anything like that. And then lastly, local dollars. We receive $1 million for flexible that we could spend any way we would like. So that would be our last expenditure or last use of funding. So the COVID buckets have been changing. We could up until last week we had a bucket that was for contact tracing, and then that changed last week where we lost funding for contact tracing, but they still have money for case investigations. So it's generally been a fluid change, and we're working with those agencies, with the FEMA agencies. DOH is working with the FEMA agencies to kind of get them used to the way that the health districts across the state have operate. That help, Commissioner Lynn?
Yes, thank you.
Yeah, and if I may just add also for any of our board members, but specifically our newest board members, we can always schedule meetings throughout the coming weeks to get into specifics on finances and policies and so forth to better equip you for these meetings.
Yeah, Commissioner McKinney and Commissioner Linder, you guys are a little bit of a disadvantage as you're coming in at the very last quarter of the year, and everybody else has seen the experience and the growth, how our financials have reflect how we've been dealing with this crisis. So if you guys would like to speak, that'd be.
I don't know. Well, I've been attending these meetings as a member of the public, so I've been reading about financials. So yeah, I appreciate that.
Okay, will you move in? Any more questions about the income statement? All right, will you move into the next page, please? This is our details per our programming. So our income statement is agency-wide, how everything looks as an organization as a whole. And this dives into each individual program that we have here at the health district. The top half is mainly administration programs, the yellow and green. The purple and brown and peach color are mainly community health programs, and the blue is environmental health programs. The big one is the COVID response. We've spent almost 1.5 million. That loss for 44,000 for the COVID response has to do with us not being able to charge indirect rates at the beginning of September. There's nothing specific I'm going to point out on the project programs, as they have been consistently around these losses and gains throughout the year. Next page, please. Again, this is wrapping up the programs, mostly in environmental health and developmental disabilities. Any questions about the programs? Okay, let's move into the last report for, this is our COVID report. This, at the very, very top, you can see with our revenue, looking at the funding side, our state was reduced down to 20,000 for funding, but we're able to move some money that we've had for state funding into next year, while we're trying to maximize our federal funding. And you're seeing that right there, where we're trying to spend federal first and state last. We worked with DOH to make that happen. And we have about 5.3 million in federal money that is available up until December 30th. So we're really trying to maximize that in the next few weeks as we move to the year end. I expect there to be money, additional money next year in 2021. However, that is not secured. Well, we do have state secured money for 2021. So moving down, I'd also like to point out the advertising promotional. We've spent $161,000 so far this year in advertising to the community. So our outreach to the community has been very, very strong. I just wanted to point that piece out. Is there any additional questions about the COVID income statement? Okay, last but not least, the cash flow. So we receive, like I said earlier, we receive $1 million from the state every year to spend on programs as we see. We get those fundings in two lump sums. We get $500,000, just over $500,000 in January and July. You'll see our cash balances uptick in those months, but then start to trail, kind of downtick as the year goes along, and then back up in January and then July. So that's what we're seeing here now. We're seeing in October our cash available has decreased down a little bit to 7.8 million. Any questions about the cash flow? Okay, that wraps up my report. Thank you so much.
Thank you, Chase. So if there are no other specific questions for Chase, I would entertain a motion to approve the financial report for October 2020.
This is Sean Cleary. I move to approve the financial report.
Thank you, Dr. Cleary. Is there a second?
We'll second it.
Hey, Funk, I'd second.
Thank you, Dr. Funk. Any discussion? All those in favor say aye.
Aye.
Opposed, same sign. Okay, thank you. Let's go on to Ryan Ibach, Chief Operating Officer. Ryan.
Hi, hello. Ryan Ibach, Chief Operating Officer. I've been at the Yakima Health District for almost 22 years. I started out as an environmental health specialist inspecting restaurants. In 2015, I became the environmental health director. In the last 4.5 years, I've been in my role as Chief Operating Officer. So I oversee the management team, the human resource department, and our emergency response coordinator position and day-to-day operations. So the first thing I want to discuss today is that we do have 3 board members' terms who do expire at the end of this year. Gail Weaver, who's a citizen member, is serving a 4-year term. Dr. Kay Funk and Barbara Hare are serving as city representatives, and those are 2-year terms as declared in the resolution by the Board of County Commissioners. Historically, when a term does expire, if a person's willing to continue on another term, then there's a motion and the board by majority votes whether to, for those people to serve as another term. There is by a resolution of the Board of Health, there is a process in place that if there is an open position, then the process is that if it's a city position, city representative position, then we advertise to the cities. If it's a citizen representative position, then we advertise to the public of any openings. At that time, once we receive candidates, they submit their qualifications and letter of interest, and we would have a selection committee interview the candidates, and then the selection committee would introduce a proposal to the board on their chosen candidate, and then the board would decide, would vote on whether to approve that person, or appoint the person to Board of Health. So this time, all three candidates, or not candidates, all three board members have expressed interest on serving another term. So if we were to move forward, then we would just need 3 separate motions to vote for another term for these 3 board members.
And I have a point of order question. My understanding is that the Yakima County Board of County Commissioners is the one who makes the appointments of these positions. It's come up in our agenda meetings. And so I wonder if this vote is premature.
Yeah, the Board of County Commissioners, the resolution states that it is decided by the Board of Health by majority vote. And we have that resolution, which was amended in 2018.
Can we have Mr. Elliott chime in here, because our Board of County Commissioners attorney has advised differently?
I have not yet had a chance to review the resolution that Ryan is describing, so I think any instruction from me would be premature on that, Commissioner McKinney.
Thank you. I would move to table this until we can provide clarification to the board.
I was under the impression, yeah, that the commissioners were the ultimate ones that did the appointment as well. So yeah, some clarification would be nice. Or is it a process where the district board makes a recommendation to the Board of Commissioners? Anyway, yeah, some clarification would be nice.
Yes, and again, as Ryan mentioned, if I may, there had been a change to the resolution process. So we can send the newest resolution to you for your review, and certainly for your attorney's review.
Great. I think we'd like that first, and we'll review it before any motion. I think it should be tabled until there's clarification.
I think one area for clarification would be from me from both sides. So Ryan, if you could present me with both the resolution you're describing and the information that relates to the commissioners that is being described by Commissioner McKinney and Commissioner Lindy, that would be helpful.
Sounds good. I'll send James the resolution from the Board of County Commissioners and the resolution on the process from the Board of Health stating the process.
Thank you.
And just for point of reference, can you tell me the names that you stated were up? I remember you said Dr. Funk and Gail Weaver, but
and, Barbara Hare.
Oh, and Barbara Hare. Okay.
Yeah. So the 2 city representative positions are 2-year terms, as described in the resolution by the Board of County Commissioners, and then the citizen representative position is a 4-year term.
Oh, okay.
And the 2 positions are to alternate, so they're not the same year. So every 2 years there's 1 citizen representative, according to the resolution.
Okay.
Ryan, can you also quickly describe for everyone how long each of the members have served for, please?
Yes. So Barbara Hare is actually the longest serving board member in the state of Washington. She served for decades. Gail Weaver served, Gail is at 2009.
I think it's 2013.
Okay, thank you. 2013 for Gail Weaver. Dr. Funk has served since she midterm when Maureen Atkinson left office. She took her place for 1 year and then was reappointed 2 years ago. So she's been on the board for 3 years.
Thank you.
So at this point, Gail, do we want to table?
Yes, it sounds like we need to table until more information is available to the board.
This is Kay Fung. I'd like to comment.
Yes.
I think that the bylaws of the health district should prevail here, even if there is a conflict with the county bylaws. It's clear that the Yakima Health District Board is a separate entity. I'm a little concerned that tabling will not allow this to be resolved by January 1st, which is when we need to have board members seated. Can that be clarified, please?
I do, Gail, if you'd like me to read, I do have the wording directly from the resolution I could read.
That would be great. Thank you, Ryan.
So this is the Yakima Health District Board of Health Resolution 2018-03. The section that pertains to selecting the board members says, whereas pursuant to Board of Yakima County Commissioner Ordinance 2-2018, amending section 6.04.010 of Yakima County Code, allowing the Yakima Health District Board of Health to appoint 2 elected city officials and 2 citizen representatives to the Board of Health.
If I may, Gail, we do have sitting board members in those positions, so we do have representation. So perhaps, as you described, the answer is to allow those board members, including yourself, to continue to serve until such time as the board has reviewed the bylaws and certainly our attorney has reviewed, discussed this. Would that be acceptable to you?
So from a board perspective, so we're getting into some legal issues. Our attorney is on the line. So that's a question of, can we continue as board members with tabling this until a decision can be made with more information?
I think the first thing is it would be helpful for me to be able to review not only resolution 2018-03 that Ryan described, but also to the extent that commissioners have some information they have described, it would be helpful for me to see both of those first. I guess what I would say is one option for the board is to get me that information. We have a possibility, as I understand it, the board members can continue through this month. It is possible to call and have a special meeting prior to January after having an opportunity to review this and discuss this with the board. That's an opportunity for us as well.
Correct. We can have an emergency meeting of the board if we need to take action by January of 2021. It sounds like we may actually have 2 items. One is continuation of board members or election of board members, and one is the contract for the health officer. So that's an option that we can look at as a board. So any discussion on that?
This is Kay Funk.
Yes, Dr. Funk.
I think that Andre's proposal, and I would be happy to put this in the form of a motion, is to continue to have the seated board members in place until a decision was made at the January meeting. I think that would resolve our problem here.
Okay,
There's
if that's,
30 days upon review, so your seats will be held until the end of the year. And then I believe that there was a 30-day, we make replacements or people continue the decision within 30 days. And this is getting into minutia, but I think we do have the opportunity here of more time on our side, given how early it is in the month. So I think if we get clarification, we'll be able to have our special meeting in a timely manner.
so Dr. Funk, did you make a motion?
I would be willing to, I didn't really make a motion, but I would make a motion. I am generally against the idea of having to count on extra meetings when we don't have our ducks in a row to make a decision. I think that's something that we should stay away from. So my motion would be to have the seated board members continue as board members until we have a resolution on this issue, which we expect to get at the January board meeting. And we're not having a meeting at the end of December, are we?
That is correct. There is
Okay.
not a planned meeting at the end of December.
Then I think it's best to continue with the seated board members until the January meeting where we can get resolution.
Okay, there's a motion on the table. Is there a second?
Sean Cleary, I will second the motion.
Okay, there's a second. Any discussion on the motion?
I would still like to
Motion
have
to
the
amend until the end of
written
the year.
description of this process that Ryan had promised earlier. If we can get that in December or early January, we can review that prior to the meeting.
Okay, thank you, Dr. Cleary. Someone else had a comment.
I was going to make my own motion to recommend service through the end of the year until we can have a special meeting.
Okay, we have one motion on the floor, which is to continue with the people on the board seats until the January meeting, and we'll vote on that one, and then we've got a second motion. So the first motion is Dr. Funk's motion, which was seconded by Dr. Cleary, to continue with the 3 current board members until the January meeting when we have more information. So let's vote on that one. All those in favor say aye.
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 Okay, and all those opposed?
Aye or nay.
Yeah, thank you. Okay, so
Commissioner Lindy, did you say something?
I said nay. I was hoping before the vote to just simply say that I thought we would have the opportunity to have an emergency meeting anyway, since we already know that we need to have a discussion about Dr. Yucca's contract. And I would assume that we would want to do that sooner than later. And so I kind of thought the opportunity would already present itself to have this, I assume, a December meeting to have the discussion about the contract, and then we can clarify the the appointment issue for the board members.
okay, we have a split vote as I see it. We also have a, so as I understand it, Commissioner McKinney, your motion is to have board members, help me out, serve through the end of the year.
Yes, my motion is for you to continue to serve through to the end of the year to fulfill your terms, which is technically what you're already able
Correct.
to do.
Correct.
And then to
Correct.
make a decision later when we have our special meeting, as Commissioner Lindy expressed.
Okay, and so is there a second on that motion?
I will.
I have a point of order.
Yes.
Did we have a count on the split vote?
Well, I can't tell about Barbara Harrer, frankly. So Ryan, can you help me a little bit about the vote on Dr. Funk's motion?
Or Victoria, are you able to communicate with Barbara? You're on mute if you're trying to talk to us.
She is on the line.
Sorry, can you hear me?
Oh, yes.
I voted in favor of it.
She voted in favor of which vote, Barbara?
Oh, of Dr. Funk.
Of Dr. Funk's.
Okay, so with Dr. Funk's motion, those in favor, give me the specific names, and so we have the count.
Well,
I believe that it was Dr. Funk, Dr. Cleary, yourself, Gail, and Barbara.
And those opposed?
I believe it was Commissioner Lindy, Commissioner McKinney, and Commissioner Anderson.
Okay, so that motion passes, correct?
That's what it sounds like. And that motion was to basically, if we haven't come to a decision, to be able, that those that are currently appointed would be appointed until the next meeting. Was that in January? Is that correct?
That's correct.
Okay.
So then we had another motion by Commissioner McKinney, which would change the first motion. So, I mean, would change, not the first motion. It wouldn't change that motion. That motion passed, but we do have a second motion on the floor, which would be in opposition to the first motion. So we do need to finish that particular motion. We have a second, as I understand it. Is that correct?
Well, Gail, I did give a second, but I guess I would say in light of the vote that was taken, I'll probably just withdraw my second because it sounds like a pointless vote.
Okay, all right. So let's go back and make sure that we're all clear. So as I understand it, the three positions that will be expiring at the end of December of 2020, with that motion, those people will continue in those positions until we get additional clarification, which will come before the January board meeting, where there will be a decision made as to those positions. Is that correct?
Gail, may I ask for one additional clarification? It's Dr. Clary.
Yes.
Is there a need to approve the contract with the health officer prior to the end of the year? Will we have to have an emergency meeting anyway?
So Andre?
Well, it's the board's choice. We could have an emergency meeting, or we could have you review it by contract by email. If the board wishes to review Dr. Yucca's contract and then discuss it at length, then probably it's best to have an emergency meeting. If you feel that reviewing it and accepting it could work, we could do it by email, but that's the choice of the board.
This is Commissioner Anderson. I would, given that we need to approve the contract, review it and approve the contract with Dr. Yucca, I think it's imperative that we have an emergency meeting sometime in this month to get that, at least that issue settled.
I would like to just add something. If we're waiting for approval from the board, where does that put us for Dr. Yucca for standing orders?
No, what we're moving for, Melissa, is approval of his contract, not his service. So I think we're good with that. That's what everyone agrees to.
I don't think anybody's opposed to a service. We just simply want to have the details of the contract. And I would agree with Commissioner Anderson that it would be good to have that sooner than later. I think that's in all of our best interests.
And Dr. Cleary, I'm assuming part of that question was, it sounds like what I'm getting from the board is we need to have an emergency meeting in December to review the contract for Dr. Yucca.
And if that's the case, I think we could leave Dr. Funk's motion that can still stand, but it would be nice to have the information about the selection of the board members prior to the emergency meeting, and perhaps we can accomplish those two duties at that one meeting.
Okay. Any other comments? Commissioner Lindy?
Yes, I would just say that I would concur with Dr. Cleary's comments.
Okay.
And this is Ron, I would as well. But they are two separate items.
All right. Thank you.
Do you like me to make my motion again?
So, yeah, go ahead.
I would make the motion that those serving continue to serve through December until we meet to discuss both items at the special emergency meeting we have agreed to happen at our earliest convenience when the information is available to us.
Okay, is there a second?
Point of order.
Yes.
We already passed a motion on this.
Correct.
So I don't understand.
Would you like me to make a motion to vote to disprove the previous past motion first and then make my motion?
We can always have a special emergency meeting without a motion. So if we need to, before the end of the year, have a special meeting, that can be called.
Yes, and if I could just add, we certainly can work in earnest with James Elliott to make certain that that's been reviewed, and then also share that with the board. So we can do that in a timely fashion.
Well, and in line with your question, Dr. Funk, your motion has been passed. And so if no other action is taken, then the current board members serve until the January meeting. If we do have it sounds like we probably will have an emergency meeting. If we, during that meeting, also are able to deal with the positions that are expiring, then we can do that at that time. But that gives us the leeway of allowing it to occur in January unless there's another action that's taken by the board. Okay, are we okay? All right. Any other discussion on this? So it sounds like we will be setting up an emergency meeting, and we'll get out the agenda items and any information ahead of them that time. So Ryan, back to you.
All right, so schools. Last board meeting at the end of October, we discussed the rationale behind the recommendation for in-person learning. To date, we have a total of 56 schools, public schools that are in-person learning, and 9 private schools in-person learning, for a total of 65 schools that are currently in-person learning. When we made the recommendation was that we go back in stages, starting with the youngest kids first, K through 5, and then a 3-week period before we went middle school, and then a 3-week period before high school. Many of the superintendents decided to even extend that longer, not go back right away, wait a little bit longer, and extend the time between even more than 3 weeks. So the data shows that in the last 2 weeks of the 1,410 total cases in Yakima County, 156 of those are school-age kids, ages 5 through 18, which is 11%. We know that the high school over the last 2 months has been 42% of the total cases in school-age kids. In the last 2 weeks, there have been 61 cases in high school kids. Currently, we've had 5 schools that have had at least one closure, and we've had 3 total schools that have voluntarily closed on their own. So when they notified us of multiple cases in the school, that they were volunteering to close on their own, through the 2 of them through the Thanksgiving holiday. We have
Ryan? I'm sorry, excuse me. So I just want to make sure I got that, understood that correctly. So you've had 5 schools where they had an individual classroom closed down?
Yes.
And 3 entire schools that have closed down?
Yes, that is correct.
And what was, without getting too deep in this, what led to the classrooms closing down, and what led to the schools closing down, if you don't mind?
Usually it's just the multiple cases in a class. I know one high school, they ended up having their 3rd case in about 2 weeks. None of those 3rd cases were, after our investigation, were determined to be linked of transmission in the school, but they just decided to hold off, go get through the week before Thanksgiving and then reopen after Thanksgiving. And that's been the case with most of the classrooms too. There's been actually a couple different scenarios. One where there weren't enough teachers, because there's multiple teachers in the same grade level. And so that elementary school decided to hold up, to close classes. Or there's been a couple kids in the school, or actually in the classroom so they decided to close the classroom.
Ryan, could I ask, when you use the term closure, I think it carries a lot of negative association. And I would say in your first example, being familiar with the school you're referring to, it wasn't a closure. It was a determination because they had ability to remote learn, and because it was a short week anyway, they decided to have the students remote learn for the 2 days, Monday and Tuesday. So I point it out because I think the words that we use and the way we use them can have an impression on people's mind and cause them to have a knee-jerk reaction that that's a negative and something we should be concerned about, when in fact it was a school being very proactive and not closing. So I just want to be careful when we use those words.
Yeah, as I stated, there was voluntary closure. They closed voluntarily.
Okay, so as a follow-up to that then, with those classrooms, have they since reopened? And the 3 schools, have they since reopened? What does that look like?
Yes, they have reopened.
Oh, so all 5 classes and all 3 schools have reopened?
Yes. Mm-hmm.
Okay, great, that's, okay, thank you for that.
So in-person learning, we've had 63 staff members that have been in buildings, and this goes back to August, and we've had 48 students in school that have been positive. So we've had 111 total people. We've had 36 in the last 2 weeks of those 111. What we do is we communicate with the schools, we communicate with superintendents, principals, school nurses, and so when there is a positive, we can quickly isolate the positive person and we can quickly quarantine any close contacts to that person. So moving forward.
Ryan, I have a question real quick. How many of those staff member adults, though, the contact tracing proved that they contracted the virus from the children as opposed to outside of the school setting?
Yes, thank you. Yeah, that's for my notes. We have 5, so far we've had 5 cases of those 111 that have been believed to be linked to in-person schooling. So the other 106 are believed to be community transmission.
Thank you.
Mm-hmm. We do have 6 high schools that are currently in-person learning. The recommendation was made because of the increasing case numbers, the rollback of businesses, the increased hospitalizations, that we put a pause on moving forward with any high schools, and that's the recommendation. The superintendents have made it very clear that they don't want to go back and forth. And so if they didn't want to open up and then have to close down again and reopen, we also want to protect those that are in-person learning right now, and to add high school kids to the population, the school population. We don't want to overload. We have a disease investigation team that's working on every single positive case. We work to quarantine. We overload the nurses, the school nurses, to deal with these situations. Add more students to the transportation system, to the busing, and also we just want to make sure that we don't want to jeopardize those that are already in learning. We talk weekly and daily with superintendents and principals. We understand the concerns that many of the people expressed in their letters, as far as emotional, kids failing. We talk to them daily, and as soon as we can find a time when kids can go back, we can move forward with high school, then we will change our recommendation.
Ryan, I just have a clarification that I'd ask of you. Would you describe for everyone who we is?
The recommendation is from our health officer, and then continuing with discussions with the with superintendents that are interested in opening. There've been discussions with Dr. Yucca and Andre, the executive director.
So we making those decisions that you just described is a combination of our health officer and health director?
Our health officer, our executive director, and also conversations with superintendent.
Thank you.
And Commissioner, I can also mention that we're in constant contact with the state as well in terms of their discussions with the Office of the Superintendent for Public Instruction, OSPI, at the state level. So it has been a partnership. And as Ryan mentioned, our goal has been to ensure that kids who are in school can continue to be in school. We realize the impact not only in those children in terms of learning fundamentals, but also working families. We know how difficult it is. The other
Thank you
concern,
for that clarification, Andre, and I am glad you're working with the state, but I also appreciate that the decision regarding schools is a local decision. So I wanted to make sure it was clear on who we on the local level was who was making this decision. Thank you.
Yeah, we definitely feel important to get the input from superintendents and principals. And so whenever we make a decision or a recommendation or proposed recommendation, we do bring it up with superintendents because we want to hear any of their concerns before we move forward with any recommendations.
Is it safe to say the superintendents, though, are feeling that they're not able to make decisions because we're not able to commit to them, we, the health officer and the health director, on what the policy would be? And so they're describing a sense of not being able to get insurance. And so it seems that we are the ones who are causing uncertainty. And so they are making decisions that are reactionary to the committal or non-committal of specifics that we can provide as a health officer and health director.
As a health district, we look at all the data and information. We listen to the different stakeholders, and we make a recommendation based on public health practices. And so that we have to make the recommendations, and then the superintendents can move forward however they're able to.
yes, I would share, Commissioner, it's not a question of uncertainty, it's a question of what we have continually said from the beginning, which was to ensure the safety and well-being of students in the classroom. That's not changed. In fact, Lion's been working since really since pre-graduation of last year to ensure that there is that kind of discussion. We recognize that this is a really difficult time. We know that there are people on both sides of this who have very strong concerns in the community about in-school learning. The problem for us is that older students, young adults essentially, are more susceptible to the illness. And so we are seeing dramatic rises in cases here. So while we do recognize that this is a very acute issue for schools, for staff, for teachers, and for parents, we are also in a community that is imperiled by the virus. It is a dramatic situation that has essentially exploded over the last 3 weeks. So that is why we're resolute in our concern for increasing in-school learning. What we're trying to do now, as Ryan mentioned, was protect those children who are in school. We want to make sure that children learn. We don't want to be disruptive to families, but we really have to be committed as we've been. So there's no uncertainty. It is just a difficult time because we are right in the middle of a massive outbreak.
So is the well-being of the children, has that changed? So the younger children, and truly, correct me if I'm wrong, but I believe statistically that even those who are through high school level of 18 and under seem to be negligibly impacted by the virus. So if the goal is safety and well-being of the children, it just appears to me, and based off the public comments, it seems to me we're keeping our children out of school because we're more concerned about the impact it might have to adults rather than the children. That's what I'm gathering from public comment.
I wouldn't characterize it that way. I think that young adults, as adults, are susceptible to the illness far more so. And as Ryan pointed out with the numbers that he shared, there's a dramatic increase for older students. And so the real complexity is that we have increased transmission in our community socially, and that transmission won't stop at the door of the school. The difficulty is that even if somebody isn't impacted dramatically to the point where they're hospitalized, they can still be carriers, which means that anyone who comes in contact with them, whether it's in school or in the home, are also in peril. So this is a community-wide issue and the community-wide transmission. And the data that we have is also showing that it's throughout all of our communities, both large and small in Yakima County. So it's a dramatically
Andre, Dr. Funk has a comment. Dr. Funk?
I'm sorry, I didn't see that.
Yes, my comment is that this is a disaster for all of us. This is a shared disaster. It's a natural disaster. Listening to community input needs to be tempered with a huge body of scientific expertise on this issue. And we don't, there are strong feelings on both sides, but polarization and blaming is not going to be productive problem solving. We need to work together, and so I'd like to move on through this issue.
Dr. Funk, this is an opportunity though for the public's voice to be heard, and our place on the board is to ask questions to clarify. So respectfully, these questions are important.
If I could just follow up with a question, because I would concur that, there are strong emotions on both sides, but we get a lot of public input, not just from the school district or the employee side, but from parents and from kids themselves. And so therefore, I think the detail is worth it a little bit. I just, two follow-up questions. One is for Ryan. So at this point, as far as the high school, the recommendation to put a pause in the high school for right now, that is simply a recommendation rather than a requirement. And I guess the question is that in writing? Do we have that in writing somewhere?
Yes, we do. And the ultimate decision remains with the superintendent and the school board. And so, yeah, we do have the in writing on the recommendation.
Okay. And which are the high schools that are currently open, Ryan?
So we've got the one public school is Nat Cheese High School. And then the private schools are LaSalle High School, Riverside High School, Sunnyside Christian. I'd have to look at my list, but they're private schools.
Okay, very good. Yeah. All right. Okay, thank you, Ryan.
You're welcome.
Okay, thank you for the clarification. So Ryan, additional comments?
That's all I have.
Okay, thank you, Ryan. So let's go on to Nathan Johnson, our emergency response coordinator. Nathan.
Thank you. Good morning, everybody. Nathan Johnson, local emergency response coordinator. I've been with the health district for about 2 years now. Previous experience as a first responder and working in the hospital emergency room. I also have a bachelor's degree in emergency management. Really, my position is to be working with and coordinating with our community partners to prepare and respond to public health emergencies such as COVID-19. So specifically with COVID-19, some of these include community-based testing, vaccinations, PPE, ambulance transports, and things like that. So real quickly, I want to touch on our newest community-based testing site. So we opened one 3 weeks ago now at the Sundome in partnership with Signal Health in the State Fair Park. That is going well. They continue seeing high numbers. Just yesterday, they hit 437 tests a day, and they are designed to do up to 500 tests a day. So we're definitely seeing the need from the community and a want from the community for that resource, and they continue doing great work over there. We're also working on opening a second community-based testing site in the Lower Valley, specifically in Sunnyside at the Community Center. This is in partnership with the City of Sunnyside, Comprehensive Healthcare, and also Columbia Safety, as well as the State Department of Health and UW Laboratory. This will open up on Sunday. It will run from Sunday through Thursday from 9 to 3, except for Tuesdays, it'll go from 12 to 6. And one thing that this does is it now gives us some form of community-based testing 7 days a week within our community. So even on the days that the Yakima site it will be closed, we'll have the Sunnyside open and vice versa. It also provides the entire weekend to be covered, and it provides 2 evening options throughout the weekday. So Tuesdays and Thursdays. Tuesdays will be 12 to 6 at the Sunnyside site, and Thursdays will be 12 to 6 at the Yakima site. So it gives those evening options for the community members. So this is pretty big deal because we've been trying from day one really to ensure and master the low barrier equitable testing within our valley. And so this is all free of charge. And so again, that will be opening up on Sunday. We'll be doing a press conference on Friday with Commissioner Lindy, and we'll also have representation from Yakima Health District, City of Sunnyside, and Comprehensive Healthcare, as well as Astria Healthcare as well. So pretty exciting news on that. Any questions specific to our community-based testing sites? Dr. Funk.
Yes, I'm extremely delighted to hear that you've got those testing sites going and that you're getting that volume in. I think that, and I'm delighted to hear you talking about low barrier and equitable. Part of low barrier in terms of the staff hours required is rapid and accurate identification of who's getting tested. And that's going to be equally important going forward with vaccine distribution. So, and as we know, we don't have everybody living in Washington State on a coordinated database. So what are you currently using for identification in order to be rapid and accurate?
As far as being able to identify who in our community is getting tested?
Well, to identify each person tested as a unique individual that gets testing and ultimately gets 1 dose of vaccine and a 2nd dose of vaccine.
Melissa, do you have anything you'd like to share specifically around that?
For identifying for vaccine administration? I don't.
First identifying for testing and then identifying for vaccine.
So are you wanting to know more specific for testing? I believe, Nathan, the test for testing, they show identification or they fill out the form themselves, correct? We're not.
So showing a driver's license does identify a unique individual. I think that the younger patients, say less than 18, whatever time the state pediatric vaccine database was created and broadly used, that would provide identification of unique individuals, but that still leaves a lot of people that fall through the cracks.
Yeah, so the state has a vaccine system that is used both for childhood vaccinations and adult vaccinations. So we can pull up someone's vaccination records, see what doses, what date they got that vaccine. As far as testing, that's a little bit separately. We do register everyone who comes through testing into a database. This is through the UW lab. It's called Solve. And we ensure when a patient comes through that all their demographic information is correct. And they're asked this information if they choose to register online, and then that's confirmed when they get on site. Or if they didn't register online, they provide that information on site right then and there. So, and using that, we're able to pull reports, and we get weekly reports from our community-based testing site as far as what ages and some of the demographics we're seeing that are coming through our testing sites. So we have an idea of where that need is in the community and how we can do other outreach to maybe hit some targeted groups that we're not seeing come through testing. Does that answer your question?
It's getting there. So does that UW registration database coordinate with I'll call them vaccination databases already in existence, both pediatric and adult? Are we working towards creating a system that identifies unique individuals kind of across the state to facilitate these public health processes?
Yeah, so at this point in time, the testing demographics in that database is totally separate from the vaccine database, and they don't play together. I will certainly reach out to UW Lab. I know UW Lab, not only as far as just COVID testing, but COVID response, is working on how to make systems work more effectively throughout the entire state. Again, it's not just our county that's sending lab results to the UW lab. So I can reach out to them and see what they're working on as far as having those two systems, both for testing and vaccines, if there's any talks on the state level of having those coincide.
I think that's very urgent, and I would appreciate y'all doing that. Because as we know, this is the same problem we have with electronic health records. We have all these electronic health records, but they don't communicate. And that is just a huge sink of financial cost and personnel cost, a black hole, so to speak. Thank you.
Sure. Thank you, Dr. Funk.
Nathan, if you don't mind me sharing, Sue, Dr. Funk, your concern around a two-dose vaccine is valid. We feel that the vaccination that may happen through clinics or hospitals will be well managed because people have what we refer to as a medical home, a relationship already. But it is less than ideal to have a two-dose vaccination process for community-wide testing. So that is something that Nathan is working on, our team is aware of, and it is a complication that we're looking to overcome.
Okay, thank you. Nathan, did you have anything else?
Yeah, I real quickly just wanted to touch on vaccines. There's still a lot that we don't know yet. It is still at the federal level, but we do know that there are two companies that are getting close to the final processes to get the emergency use authorization from the FDA. That's both the Pfizer vaccine and the Moderna vaccine. They're both two-dose vaccines. So again, this is at the federal level. It'll get approved by the FDA. Once it's approved by the FDA, the other federal group that deals with immunizations will review and come out with their recommendations anywhere between 24 and 48 hours after the FDA's approval. And then specifically in Washington, our state has joined the Western Pact with other states, Oregon, California, Nevada, Colorado, that is built of health experts to review the vaccine. And they're not just reviewing it once it gets approved from the FDA, they've been reviewing it through the entire process. And then, so once the federal recommendations come out, the state's anticipating another 24 to 48 hours before the Western Pact has their recommendations. So we don't have a magical crystal ball for when we can see vaccines in our state and locally. News articles circulating are saying as early as sometime in December. But regardless, we know that it's going to take time for our state and our community to get the amount of vaccines to properly vaccinate the entire community. What will happen is we'll end up getting a small portion at the very beginning. Obviously, the vaccine will be limited because there's only 2 companies creating it, and there's issues with production and supply chain. So we'll be working and have been working with the state around allocation recommendations. And that's a constant discussion with the state and also locally with our partners and Dr. J as well, as far as once the state rolls out their recommendations as far as allocation, what makes sense for our community specifically. Again, realizing that we have a lot of healthcare workers and vulnerable populations that we may need to really take a look at hard in our community. So that's my little spiel on the vaccine. There's movement, but again, it's still at the federal level, and we don't know how much and when exactly we're going to see it in our community. But we are working with our community partners to be prepared for that arrival.
Okay, thank you, Nathan. I'm going to move us along. We had good discussion, but I realize I'm hoping everybody can stay on for a little bit longer.
Dale,
So
I do
let's.
have a question for Nathan, please, real
Yes,
quickly.
go
Just
ahead.
a comment that you made about having enough vaccination for the entire community. And so is the discussion at the state level and locally that we're assuming that we're going to vaccinate our entire community? And is that's something that we're preparing to order that many vaccinations for every person in the community, which would seem based on an assumption that every person in our community would voluntarily go get the vaccination? How are we coming around that decision that we would need vaccinations for everyone in the community?
Sure. Our goal is to have as much vaccine in our community to take care of as much community members as we possibly can. So that would be our entire population. We know that there are people who may not want the vaccine, may have reservations about the vaccine, but that's not going to stop us from preparing and being prepared to give that vaccine to anyone who needs it. And so we're definitely anticipating getting that end goal to have enough in our community to not only just hit a certain group or a certain portion of the community, but really have it accessible to the entire community.
Understood. I appreciate that. I just wanted to make sure it wasn't indicating that there was somehow down the road going to be a requirement of some kind.
No. So we are really, we want to make this accessible to anyone in our community who's going to want the vaccine going forward.
Okay, Dr. Funk? Dr. Funk?
Yes, I think it might be helpful to speak to that a bit. There has never been involuntary vaccination of adults ever. The issues around involuntary vaccination have to do with vaccinating children who are unable to give consent, and whether the state takes an in locum parentis role to give consent for vaccinations. I've been getting multiple robo letters about concern for involuntary vaccination, and that's not an issue that's on the table at all.
Okay,
Thank
thank
you.
you.
I just have one other comment. Indian Health Service, which may be bypassing the Western States Pact, is scheduling immunizations on December 10th and 11th.
Okay, thank you, Dr. Cleary. Any other questions for Nathan? All right, let's go to Dr. Yucca, Health Officer.
Okay, I'll try to be brief. I've been here, I guess, less than 2 weeks. I'd just like to say I'm very impressed with your leadership. Andre has done a good job of getting me on board, and all your staff have just been welcoming, and I'm really impressed with the caliber of staff you all have at the district. So with that, and we were talking about schools and a lot of subjects, but I think put in perspective of what you had at your last meeting for this meeting, some of the statistics are alarming. Average, and Andre started with that we're in a second wave plus. Average number of cases per day were 25 at your last meeting. They're 108 now. They're 119 yesterday. Number of daily patients on ventilators were the same. Lives lost since the last board meeting, there were 11 last board meeting, there are 22 this board meeting. Testing positivity rate was 7.2%, and it's over 12% now. And the case rate per 100,000 people over the last 14 days was 82 last board meeting. This board meeting is 590. So you can see, we really have an uptick in Yakima. And the goal of overload on the medical system is what we're trying to prevent. We've seen this. We're seeing burnout. We're seeing a lot of hospitals throughout the nation are swamped. They're not giving good service. And this is not the place we want to be. So we need the whole community to be with us. And my concern is the Thanksgiving fallout. I'm afraid these numbers are going to continue up. It'll be the next 10 days we see this Thanksgiving fallout. So we'll see how that is. The slow lab times, we're seeing lab now throughout the state, 7 to 9 days return on testing positive, tests. That concerns us, at least concerns me. And the stress on the medical system is my biggest concern. And I think that's why we're seeing hesitancy. If I'm all in favor of keeping kids in school. I want to open schools, and but right now I think is when we have to pause and then rethink it. Going on, the health officer, we do have recommendations to the school board, but it's up to the school board. It's not up to us to open schools, but with our recommendations. But we take our recommendations seriously. We don't just poo-poo them. And so with that, I'll close. Are there any questions for me? I think we're up for a real next couple of weeks. I'm concerned about it, but the vaccine's going to be on its way. That's one hope. And I think the type of vaccine, we've never seen this type of vaccine before. So I hope it works better. It's a genetic type vaccine that's we don't have in any of our inventory. And the first reports are very exciting on the efficacy of it. So if we can get through this is what we need to do, is get through this next hump and get vaccines in as many people as we can. And we're not going to force people at all. We never have done that. And but if we get the majority that want it into them, I think we'll be doing a good job. So I'm sure you have questions for me. I'm brand new, just getting my feet wet.
Thank you, Dr. Yucca, and thank you for stepping up and helping us during this time. So any questions for Dr. Yucca? Okay, let's go on to Melissa Sixberry, who's our Director of Disease. Oh, yes, go ahead.
I just wanted to give a welcome to Dr. Yucca.
Oh, thank you. Thank you.
Good to have you aboard.
Okay, Melissa Sixberry, Director of Disease Control. Melissa.
Gail, I'd like to ask some questions of Dr. Yucca since it's
Yes.
his first time addressing everyone.
Sorry, I don't see everybody,
I
so
know,
thank
it's
you.
hard.
Thank you. So go ahead, Commissioner.
Thank you. I would also like to pass on my gratitude for your willingness to step in. Obviously, we had a need in the community, and it sounds like you've served many other communities and currently serve many other communities well in Eastern Washington. You've spoken a little bit about schools, and I think from a parent's perspective, and one that I hear a lot is that, of course, we're very concerned about community spread and the health and well-being of our medical staff and their emotional well-being. But I think sometimes our words can seem dismissive to people who are parents at home, who are seeing their children go through some very excruciating mental and social distractions. There is long-term impact on our children because of our decisions now. And so I know that there's a great sense among parents that we are willing to sacrifice our children for the benefit of those who are elderly and more vulnerable. And that is just a fact right now that parents feel that way. And so I do feel like we need to be cognizant of how we're speaking about children, as though sometimes that their future and what they're going through right now is kind of dismissive. I wanted to ask one thing that Dr. Everson, when she was here, spoke to was her belief of attributing deaths to COVID. And I wanted to ask you to share your view on what you would attribute to as a true COVID death. In the case that someone had an underlying, previously diagnosed or maybe not diagnosed until after, underlying health conditions such as diabetes, heart disease, or obesity, for example. So can you speak to how you would attribute a death to COVID if someone had those conditions?
Well, I think that's up to the physician that signs off on the death certificate, and we work well with them. We know some haphazardly just say everything's a COVID death, but we do know that that's not right. And I don't know how she has done in the past. I haven't got into that yet, but I will look into it. I know in Walla Walla we want to make sure it is a COVID. We're not calling everything a COVID death just because they have COVID. That is not the underlying. It might be an underlying thing, but it's not the cause of death. And so we do need to be accurate in that. But
thank you. I appreciate that.
We do have many deaths from COVID.
Yeah, duly noted. I just wanted to make sure that previously Dr. Everson's point of view was expressed that if someone had an underlying condition, even say heart disease, obesity, or diabetes, that those were treatable and therefore survivable. And if someone had COVID and passed away, that she would attribute it to a true COVID death. So I just wanted to hear what your point of view on was that. I'm happy to hear that you believe COVID should be the sole reason that someone. You've talked a little bit about your desire to push pause. So going into that, the governor recently pushed pause on all of us across the state for restaurants, food services. My question stems from if there is no statistical data supporting the fact that people are actually contracting COVID through sitting in restaurants and dining, but it is widely agreed that people are contracting COVID currently and are increasing cases is due to people having increased gatherings socially in their private areas of residence and not masking up or socially distancing. Are you supportive and do you agree with the governor's decision to close down our restaurant service when they do not have any data to show that they are the cause of this increased COVID transmission?
Well, I think he was using data from a lot of the health departments, and it was showing that there were some transmissions in the restaurants. I can't say whether, you know, I don't think it was the major maybe cause, but we have to do many things, and we abide. And I think everyone has to do their fair share when we're pausing. And so I don't know how it was in Yakima about spread from restaurants, but we do know in the state there were quite a few.
So you're
I
supportive.
have, I think you can, if everyone did what they're supposed to do, we probably wouldn't have a lot in restaurants, but they don't. So it's hard to say. But we're living with it, and hopefully not for many weeks, and we'll open them up again. If everyone does their thing now, then we can get opened as soon as possible.
Thank you, Dr. I appreciate it. I have more questions for you, but I think as a matter of time, I look forward to maybe having a one-on-one meeting with you as soon as possible. And thank you again for your willingness to serve at least interimly.
Okay.
Okay, any other questions for Dr. Yucca?
Just one, just really quickly, I'd like to follow up on this. One of the things that is, if we look at the restaurants, for example, I can understand why someone we could draw some conclusions and say, there's a possibility based on the fact that you're getting people together in close proximity, you're there with the mask stuff, you're there for extended period of time, that, this could be something that could be conceived as a higher risk activity. Nevertheless, I'm wondering if there's any willingness to have a conversation with the state could we perhaps take a different approach, which is, well, for example, I work on, I've been until recently been working in a hospital, and if anything is a high risk environment, it would be a hospital where we have, COVID patients that are there. We have doctors and nurses that treat them, but yet they do not get infected. Well, why? Well, it's because they're taking precautions. And I'm wondering if we couldn't rather take that kind of approach with some of these businesses that are severely impacted, such as the restaurants, and simply say, let's be a little creative and go, okay, well, how can we keep you open? Can you take certain precautions? Can you have certain kind of distance requirements? And if we do that, can we allow them to be open so that thereby, even if it's under certain restrictions, they can still keep their doors open, they can still keep their employees, with a job and keep their livelihood moving ahead and in place.
Well, I think there's been a lot of pushback on that, so we'll see what happens. I don't think we've seen the end, but you're right. There's many ways you can do things safely, and we'll see what happens after this pause. What is that? The December? I can't remember when it is. But
14th.
We'll see what happens.
Okay, thank you, Dr.
Thank you. All right, Melissa Sixbury, Director of Disease Control. Melissa.
So as Gail said, I'm Melissa Sixbury. I'm the Director of Disease Control. I've been with the Health District for 4 years. I'm a registered nurse. I've been in healthcare for 20 years in different positions. That's just an introduction to myself. For updates, we're currently recruiting for a public health nurse. So if you know a good nurse, send them our way. They'll be replacing a long-term employee, David Miller, who was our TB nurse, who has agreed to stay on until we find a replacement. So very grateful for him. I'll talk about some influenza. We are seeing low activity in the county as well as the state. I'm hoping that the mask use is helping to contribute to those low numbers. With outbreaks, we have an outbreak at Summit View Healthcare right now. It's a pretty large one. It's 64 current cases in their facility between residents and staff. There's 33 staff infected and 31 residents, and they've had 6 deaths out of that outbreak in their residents. I'll talk a little bit on hospitalizations. We, at our last Board of Health meeting, had 9 people currently hospitalized due to COVID. We currently, as of yesterday, have 28. So it just shows an increase in our hospitalizations. We are having, we're seeing some concerns around staffing and bed capacity for ICUs, where we haven't had no availability, but limited, and they are feeling stressed with staffing at the local hospitals. I'll talk to Commissioner McKinney on your question about deaths. Our process for that is myself, along with another nurse, review every single death that is reported. Actually, sometimes it takes a couple of days to get the website updated because we look through those thoroughly through their medical records to determine were they actually a COVID-related death or was it from something else. So we see a lot of it in our long-term care facilities where somebody has dementia but had COVID 6 weeks ago. We're not going to call that a COVID death. That is somebody who was nearing the end of their life, and COVID wasn't a contributing factor. So I can give you some numbers. We currently have 262 COVID-related deaths and deaths that have come through from people who have tested positive, but we determined were not COVID. The difference would be for people who tested positive is 349 deaths. but we've only contributed 262 of those to be COVID related. So I hope that answers your question on that.
Oh yeah, I'm understanding of how you count them, and I appreciate that. I was more interested in having Dr. Yucca share his ideological ideals about it.
For risk factors?
Correct, just, yeah, thank you.
The only other update I have, I would just add to the school situation with the kids being in school. One of the things we do know is that kids are less likely to transmit, but we also know that kids are more likely to be asymptomatic, so not have symptoms. So we could be having spread within schools with students and not know it, who's then going home and infecting their parents or their grandparents. And that's the concern with the hospital system. You know, they may not be full with COVID, but if they are filled with, we overwhelm our healthcare system, we're not going to then be able to take care of trauma patients out of car accidents with a bad winter. We're not going to be able to take care of influenza patients. So it's kind of a trickle effect where we're just overwhelming our healthcare system, and that's what we set out to do in the beginning of this, and that's what we've done, and that's what we're trying to continue to do, is not overwhelm that healthcare system.
That actually brings up a good point where, Andre, you might be able to speak to this. You and I had spoke earlier this week or late last week, where I asked if you had had any communications with the state regarding the CDC releasing their latest report stating that it's estimated now that 8 times as many people who have tested positive in the United States for COVID have actually had and recovered from COVID. And if you do the math in our county, that would mean that approximately 120,000 people potentially in Yakima County of our 253,000 people who live here have potentially had COVID already, which would of course would impact our numbers as far as statistically who has been hospitalized as a percentage of the population and how it's impacting us. And certainly it will impact how we decide to vaccinate and tests that we need to administer, things of that nature. So were you able to find any information from the state whether or not they've acknowledged that CDC report and how it will impact how we move forward?
Are you asking me, ma'am?
Yes, Andre.
Oh, thank you. Well, I did speak to a number of folks at the state level, and while what you're saying is what they believe, which is that the spread of COVID is far more dramatic than we originally anticipated. So it is in more of our community. And so you're right, it means that more people may have had been asymptomatic or had at the time an illness that they thought could be attributed to the common cold or a sore throat. So that would impact the data around hospitalizations, but it doesn't change the concern that they still feel resolute in, which is that we don't know what immunity levels are. And I could defer to Dr. Yucca on that, but the reality is that simply because you've had it doesn't mean that you can't get it again. And also it doesn't mean that you can't transmit it to others. So the concern is that regardless of whether you've had it or not, you should still really consider strongly the value of getting vaccinated, because we don't know if you have a built-up immune system.
Sure, I think it goes a long way though in acknowledging the survivability rate and how we react. It certainly would impact people's decision if they knew that that many people potentially had it and recovered from it, and likely without knowing they had it. And we're having an economic crisis because we're concerned about people still out there who would potentially get it. And if they've already had it and not known, I think people would maybe conduct themselves differently in public, and our economy could look a little different.
Well, the only thing I'd like to share is that we were very committed in the spring and summer to ensuring masking. And with the spread that you're describing, that's with all of the precautions we took: masking, distancing, staying home. If people become relaxed about this process, we could have an explosion of cases. And the problem is that you don't know how the vector works. You could infect someone who then becomes dramatically ill. That's one of the difficulties for us, and the difficulties with the communicable disease is that we don't know what the impact is on other people. And also there are many people who have what we would call comorbidities or health problems that they're not aware of. So that's the difficulty for us. And it does sound protective, but we are committed to remaining vigilant throughout this, because I think to become relaxed is to put yourself or your loved ones in danger.
The current hospitalization rate for people who have COVID is 6% for Yakima County. So as we see our numbers go up, that of course makes more admissions in our healthcare system. So we went from 9 last month at this time to 28 now. And the issue is that if we fill up our hospitals with COVID patients, there will not be nurses and doctors and beds to take care of the heart attacks, the trauma patients. And so it's not just COVID not, a lot of people not having severe symptoms, but it's the result out of those being hospitalized that overwhelm the healthcare system who can't get treatment for other conditions.
Absolutely, duly noted.
That's all from me, unless anyone has questions.
Okay, thank you, Melissa. Any other questions for Melissa? All right.
Has a comment.
Dr. Funk has a question.
Did somebody have a question?
Dr. Funk does.
Oh, Dr. Funk.
Yes, I wanted to support Melissa's remarks about healthcare staffing. We were at Memorial Hospital yesterday, and the nurse that was helping us casually mentioned that they were down 60 nurses, places that are positions for which they would like to hire but are unable to hire. I'd also like to say that attribution of cause of death is not an opinion or an ideology. It follows a set of rules that long preceded COVID, so that if a person has a positive COVID test but is hit by a car, then the car accident is the cause of death, not the COVID. That is really well worked out and established. And then the question of what's the multiplier of people who have actually experienced infection to the cases that we've identified. Again, I'd like to support that we know that there is lots more, but it doesn't really matter until we see the benefits of herd immunity, which we are not seeing at all. Cases continue to accelerate at a great rate. Herd immunity means that a sufficient percentage of the population has been infected and developed immunity that is robust enough to prevent further infection and transmission. That's how influenza epidemics terminate. That's how the 1918 influenza epidemic terminated, and we are not there at all as long as we see these increased case rates. Thank you.
Thank you. Any other comments? All right, let's go on to Sean McGee, Director of Environmental Health.
Hello, good morning, everybody. Sean McGee, Environmental Health Director here at Yakima Health District. I've been here a little over 4 years in the Environmental Health Director role for the last little over a year. I'll try to be as brief as I can and happy to address any questions. With the current rollback guidance, our EH staff is still continuing their normal routine inspections at full capacity. We were quite a ways behind with the stay-at-home order back in the spring. So we're really ramping up, trying to get our restaurant inspections caught up and our field work for land development and drinking water staying on pace with prior years. We do have protocols in place for PPE and limited number of people on site while we conduct our field work for the protection of our staff and community members. So we are taking those precautions such as masks, social distancing, and limiting the number of people on site during the inspections. So with our food inspections, restaurants have been highly impacted recently with COVID restrictions, changing of different capacities of indoor dining, the recent closure of indoor dining. So what we've been doing when we do our food safety inspections is what we're calling a COVID-19 assessment. So when we go into these facilities, we're basically evaluating more or less how establishments have implemented their COVID-19 prevention measures as they relate to current guidance. and then we educate them on what changes need to be made, or what best practices are, to educate them on how to best operate their business and reduce transmission. So that's something we're doing more as a courtesy than anything. We don't really have the authority to be punitive to restaurants or anything due to non-compliance with COVID guidelines. That enforcement lies with the Washington State Department of Labor and Industries and the Washington State Liquor Cannabis Control Board. So we also continue our response to business operation and events happening around the county that are considered not permitted or not allowed due to the current restrictions. We're reaching out, trying to provide education around the recent rules, why they're important, and offer any support that we can, or explore alternative operations or event types that would be allowed under the current guidelines, so that some business can be conducted. That's we don't want to see our businesses closed, but we also want to see our community members protected. And throughout this whole pandemic, mostly for our new board members, every Thursday I'm part of a business task force meeting that discusses how we can support businesses, different creative ways, to shop local, different ideas of how outdoor dining can occur effectively, how small scale retailers can be successful during a pandemic, or at least survive it. So we're always discussing different ways and alternatives to support our businesses here in the county. I know Commissioner Baker attended those meetings often, so I would welcome Commissioner McKinney or Commissioner Lindy or Commissioner Anderson if you wanted to join those meetings. I can forward you an invite.
It's supposed to be right now.
Thursdays at noon, actually. Yeah, and then every 2 weeks we're on a town hall meeting to discuss current guidelines and spread education throughout the community, and answer questions that come in over a live feed to the public. So we're trying to get as much information out and be as transparent as we can. That's all I have for now. I know I was quick, but I'm happy to answer questions.
Thank you, Sean. Any questions for Sean?
I just have one. Are you making, you're a great resource, and I know they appreciate it, and I know that you've worked hard to make recommendations to help our businesses, and I do appreciate that. I'm wondering though, are you making any referrals to the state if you are seeing a restaurant or any business not practicing guidelines?
Yes, we are. When we are reaching out to businesses that are willingly staying open for indoor dining, we give them the courtesy of visiting them or calling them and explaining to them what the guidelines are, how long they're in place for. We need to do our part now so we can reopen again. And if they're unwilling to follow guidelines, we have no choice but to inform the state of that.
So you won't enforce, but you are actively involving the state to enforce.
Right. So yeah, if we get a complaint about a business from a community member or anything like that, we follow up with that and we discuss the complaint with the business owner. And if they're disregarding the guidelines willingly, then we have no choice. But yeah, we'll forward that complaint on to the Department of Labor and Industries and Liquor Cannabis Control Board.
Thank you.
Real quick, Gail, can I ask anyone that has joined us has not put their name and any affiliation in the chat box, if they could do that, please, before the end of the meeting.
Okay, thank you, Ryan. All right, let's go on to Lillian Bravo, Director of Public Health Partnerships.
Thank you. So again, Lillian Bravo, Director of Public Health Partnerships. I've been at the Yakima Health District for the last 3.5 years. Prior to this, I spent the last 10 years working in various public health related occupations, and obtaining my master's in public health. So given the interest of time, I'll make sure to just do 2 updates. The first being related to our Promotora de Salud program, or our community health worker program. In September, I had mentioned previously that we launched this community-based education program, which hired 20 community health workers to provide education. At that time, the goal was to reach 2,000 families by December 31st. They ended up meeting that goal at the end of October, so we were able to secure additional funding from the Washington State Department of Health to reach another 2,000 families by December 31st. And it's looking like the health workers are going to meet that goal, which is great. So again, that means that we'll be reaching at least 4,000 families by December 31st with this team. Second, I wanted to focus on the messaging that we've been working on. Of course, we all know that the holidays are of concern in terms of increased transmission. We're already seeing that. So it is something that we've been working on for several weeks, is to get local community members to participate in sharing their stories of what safety precautions they're taking, or what's important to them and why it's important to follow some of these public health recommendations for their own safety, for the safety of their family, and for the safety of the community. So far, we've had representatives from the Latino Community Fund, from the Virginia Mason Memorial, John I. Haas, from people from Yakima County Volunteer Attorney Services, specifically Quinn Dalen, and also Chief Rodriguez, the Deputy Fire Chief of Yakima Fire Department. So we've had other community members in the past, and I welcome anyone in the community, part of the board, our new commissioners, if you would like to join us and work with us on messaging specifically over the next few months, feel free to reach out to me, and we can make sure that we're all delivering a consistent message on how important it is to follow these public health recommendations. And then finally, I want to remind everyone that we do answer questions on our Facebook page. So if community members have specific questions, or if you're receiving the same question frequently, let me know so we can make sure to get those questions answered. People can also call us at 574-4040 or email us with any questions that they may have. So I just want to make sure that everyone knows that those avenues are available, and it is something that we check frequently. Even if we don't get to answer each question specifically, we do look at those trends so we can create messages to address people's questions and concerns moving forward. So again, I definitely invite you all, especially the new commissioners, if you have any ideas or any questions that you're receiving, feel free to reach out to me directly. Thank you.
Thank you, Lillian. Any questions for Lillian?
Well, I'll just say, Lillian, thanks for the report. This is LaDon Lindy. Good to see you.
Okay, thank you. All right, if there are no other questions for Lillian, we're on to other business. So are there other business items for any members of the board?
Yeah, I do have a one correction and then one answer for one LaDon's questions from earlier. There is still one, so Simcoe Elementary in Wapato is still closed voluntarily, and they plan on opening December 7th. And then the two additional high schools are West Chestnut Academy, which is a K through 12 school, and Yakima Adventist, which is a K through 10 school.
Oh, thanks, Ryan. Appreciate that.
Thank you, Ryan.
This is Dr. Cleary. Because I think that immunizations will begin prior to our next board meeting, perhaps prior to the next emergency meeting, I would just request that the board be kept up to date and potentially have the opportunity to have an input into the prioritization of vaccinations in the county.
Okay, thank you, Dr. Cleary. Any other comments? All right, I will request a motion to adjourn.
This is Ron, so moved.
Is there a second?
This is Dr. Cleary, I'll second.
Thank you. I just want to say thank you for a very robust discussion. Your interest in public health is extremely important, so thank you. So all those in favor of the motion say aye.
Aye.
All those opposed? Thank you. We will get back to you as far as another meeting in December with the item that we've identified. So thank you very much. Bye.
Bye.
Thank you.